exposure in 2007, just in 2007. And that excludes people who were scanned after a diagnosis of cancer and those performed in the last 5 years of life. If you assume 50% mortality from these radiation-induced cancers, that's about 15,000 people who die before their time. From screening. This is from screening. Screening is not prevention, and screening could cause diseases itself, especially when they use radiation for the screening. Woo! Some of this toxicity can be blunted by making sure that the machines were delivering the minimum amount of ionizing radiation necessary to result in an accurate image. Regulations to accomplish this are forthcoming, meaning they're not there yet. There's no regulations on how much radiation the operators of a CT scan are actually using. Much more can be blunted through attention to evidence regarding the utility of CT scans in particular settings. So he's saying we could reduce a lot of the harm too if we actually evaluated the utility, like how useful is this scan in particular settings. For example, the science says the yield of important information from a head CT following blunt trauma without loss of consciousness is very low. So doing a CT after a concussion doesn't give you useful information, basically. Or the yield of a CT of the lumbar spine for regional lower back pain is worse than low. It leads to misinformation and misinterpretation and increases the risk for unnecessary surgery. Hey, there we are again. Unnecessary surgery, right? What does testing lead to? Testing leads to treatment. What is treatment from a medical doctor? It means test, drugs, and surgery. That's it, period. So you get these tests, and what does it lead to? An increased risk for unnecessary surgery. And he's saying basically, we don't even need to ask the question, how likely is it that this CT scan can be used to my advantage? He's saying the citizen patient shouldn't even have to ask that question because we have the science to define the indications for such tests and to stop underwriting their abuse. Meaning stop paying for doctors to do CT scans if CT scans are useless. The citizen patient, the informed patient, should not have to ask, is this CT scan going to be used to my advantage? Is it useful? Does it give me useful information, accurate information about an important disease of which something that I could do something about because of this test? If none of that is there, the standard should be set that we should not use that test. Okay, next point I've got here, only a